Thank you all for spending time here at this event. Beef cattle welfare is extremely important in all of our lives and is really growing and changing in definition on what we all feel like that encompasses. It's not just hotshot use, but much more broad-reaching. It includes production practices. And as we have increasing societal pressures to balance welfare, antimicrobial use, the need globally to produce food to meet the needs of 9 billion people here in the next few years, there aren't any easy answers, and it's that balance, and the veterinary community is going to be right in the middle of that mix. An area that a lot of those things come together is our production practices. When you throw greenhouse gas emissions in with the same discussion of appropriate animal welfare and our need to produce food, it gets a lot more complicated. So like most things in beef cattle medicine, it begins and ends in the rumen. I'm a little bit biased in my opinion, as Dr. Nagaraja is a friend and mentor and probably one of the brightest individuals I've ever met with respect to rumen metabolism, rumen microbiology, and helping all those things come together. Clearly he was not available today, nor were the first 3 or 4 choices amongst his graduate student proteges, so y'all got stuck with me. We're going to talk about acidosis and then roll into liver abscess formation and some of the implications, because they do fit right in this mix. And we may end up with more questions than answers as we do that today, but we'll share with you some of the things that Nog and his graduate students over the years have learned, and then a few things that we continue to kind of learn. So not to dwell too much, because I know this group's well tuned in on how acidosis occurs. U.S. production systems, we tend to rely a lot on fermentable feedstuffs for performance, for the production of volatile fatty acids in the cattle. So that's kind of at the heart of this. So the more fermentable the acids are, the higher the fermentation rate, the more we increase the likelihood that we will develop acid production at a rate higher than it can be utilized either by the calf or by the bacteria and protozoa in the rumen. We hit some tipping points that we'll discuss in a bit. The tipping points on when utilization fails to meet production, and the microbial changes, the machinery that cause that to happen, can kind of get out of control a bit. Endotoxins, and other toxins will increase, and we start to see clinical effects. Sometimes those clinical effects are recognized for what they are as acidosis. Sometimes they're recognized as what we perceive to be other things, and we'll spend some time chatting about that too. So anytime we have large quantities of a concentrate going into the rumen at a rate faster than animals are adapted for, we are at risk. 30 years ago, we used to think liver abscess formation and acidosis were all step-up problems. If we could just manage that first 25 or 30 days on feed, this problem would kind of be behind us because the cattle have adapted. Well, I'd suggest to you that adaptation happens over and over again during the feeding period, and when we're getting ready to move into the time of the year when we really have a lot of acidosis risk in our heavy feedlot cattle. We're going to get into really hot, humid weather where cattle are going to back off feed, just like most of us back away from the dinner table at quite such a high rate when it's really hot and humid. We'll follow that with cool nights and cattle charge the bunk. If we've got our dangerous rations in front of them, when cattle are at their highest intake level and their heat intolerance is exacerbated by high fat coat on dark cattle, radiant energy, a lot of those factors kind of go together, and we can get into some of our worst acidosis crisis in cattle near the slaughter weight right in this time of year. So increasing the rate, anytime we have cattle go off feed and then suddenly start eating again, so heat events, blizzard events, in our country up in north central and northeast Nebraska, mud events, anything that affects individual animal intake can really be a risk for us. some of our performance processes, re-implanting can represent a risk for us. So roughage intake often is decreased, at the same time concentrate intake increases. This is the old step-up issue. And then as we near slaughter weights, recognize that we have cattle that are physiologically less able to manage their own dietary needs than they would be when they're at lighter body weights. So kind of a busy slide, but I'll use it not to talk about the nuances of things that I have long since forgotten, but rather to remind us all that what's going on in the rumen is manifest in the animal in a lot of different ways. So if we have a lot of grain coming in, we're getting starch that gets fermented down to carbon units the size that cattle can actually utilize. When I say that, that microbes can actually utilize 2, 3, and 4 carbon units, acetate, propionate, and butyrate. They're so small they volatilize. They're called volatile fatty acids. That's the energy system for cattle. They can use glucose in the tissues, but they don't absorb glucose very well out of the rumen, i.e. not at all. But they'll take the 2, 3, and 4 carbon units and make energy sources that they can utilize. So VFA production is a good thing. Along with that, we'll have some lactic acid production going on. When lactic acid production matches utilization at pHs above 5-6, we're in pretty good shape. All is well. We're simply feeding the bugs that are feeding the cattle, and everything's pretty happy. When this starts to get out of balance and we get too much acid production, hydrogen ion will drive down pH. We start to kill bacterial cells. A lot of gram-negatives in the high roughage-fed cattle. Gram-negative cell walls, remember, from the pathophysiology, those are endotoxins, so we can start to see endotoxin effects and absorption when this is happening. Simple Halloween morning, day after Halloween, kind of osmotic diarrhea happens as we have starch in the room and we have a lot of high concentration of particles. We're drawing water into the gut, so these calves start to exhibit loose stools. As that happens, they have higher passage rates out of the GI tract, so we have a lot of fermentable starches getting pulled through. If there's fermentation product available in the stool, you tend to get watery, bubbly stools. As these cattle generate acid's getting produced, they develop metabolic acidosis. To compensate, respiratory-wise, they're trying to blow off carbon dioxide. Endotoxin will cause some depression. These guys aren't feeling very good, so all of a sudden you have a calf looking a little depressed, not feeling well, rapidly breathing, and we may or we may not recognize that for what it is. Sometimes we call that BRD. Pull them in, give them a shot of antibiotic, put them in the hospital pen, change their diet, and I call that doing the right thing for the wrong reason sometimes on these calves. So that whole complex that's going on in the rumen, it's important to understand what makes it tick and the implications that it's going to show us. So stable rumen pH, if we can maintain cattle somewhere above 5, NOG would suggest 5-6 in the data that they've generated. We've always got acid production, neutralization, not so much in beef cattle rations. Dairy cattle rations, we purposefully put a lot of buffers in. Bicarb lives here, so that's one way to help manage acid. It's pretty expensive for beef cattle rations. We tend not to do it. We get acid being absorbed, and we get acid being utilized. So that's the balance. So when we get production and utilization matching up pretty well, we're in pretty good shape. Again, NOG's data would suggest 5-6. There's a threshold there where life is good. Once we blow past that and we get down below 5 and certainly into the 4s, calves go off feed, they get lethargic. You might see calves grinding their teeth, moaning around a bit, develop diarrhea, dehydration, decreased rumen motility or rumen apnea. All those are very common clinical findings for what we'll see with cattle with acute acidosis. What's going on at the microbiological level in the rumen initially, so as we increase starch load in the diet, our total acid production represented by the red line is going to go up because we're putting more substrate there. As long as the engine's working and we have lots of bacteria there that are being active, we're going to drive total acid production up. What does happen, the green line represents the good stuff, volatile fatty acids that the cattle can utilize as an energy source directly. This starts to drop off as we undergo a microbial shift from primarily gram-negatives to gram-positive organisms. Lactic acid concentration, which is always going on at some level, either in the L form or the D form, but relatively small compared to the volatile fatty acid portion of total acid load. Once we get into that 6.5 or into that 5.5 range, starts to increase. So we're getting into the danger zone, and if you look at the pH line, the lower bar here, we're in that 4 range, and lactic acid as a percent of total acid exceeds VFAs. When that happens and the ratio, that molar percent at which that happens, isn't important. What is important is that we recognize what's going on. If we're the guys doing bunk calls, it's important to recognize what's happening and what impact we might be having on future BRD cases and how we manage that bunk later that day and how we manage the calves as they come through this. Dr. Nog would talk about this as either the acute acidosis or the subacute acidosis. We spend a lot of time over the years honestly trying to live right here. We're trying to live in a place where the lactic acid concentrations are staying relatively stable and low, but we're maximizing total acid production. That's feed intake. You know, we're trying to drive feed intake. That's really saying the same thing. This slide again is a little tough for you to see. What I want to remind you of, acetate, butyrate, propionate, those are where we're trying to drive to. Amongst those, propionate's God. That's a 3-carbon VFA. A 3 plus 3 is glucose. So that's where the products that we use, the ionophore class antibiotics, really help drive this equation to make a more efficient utilization of the energy that we have available. So we're trying to drive those equations either dietarily or with microbiological antibiotics, and ionophore is a type of an antibiotic, towards that level of production. So if we look at a graphic representation of something that you saw a little bit ago, except played out just a little differently, where we've shaded anything below pH 5, you can see this same curve where we've got VFA production hanging in there at almost all of the molar percentage of total acid being produced, lactic acid at almost none of the percentage being produced, until we hit these pH marks and the lines start to cross. So that would represent an acute acidotic event, as opposed to what we're trying to do, as opposed to a subacute acidosis, where as we increase feed intake, we get a lot of acid production, but we maintain the majority of that in the VFA stage. So what's going on physiologically? The microbes in the GI tract, primarily about 95% of the microbes we talk about are bacteria, about 5% are protozoa. The protozoa, as it turns out, are really important parts during transition. As we get into higher grain-fed cattle and more days on feed, the role of the protozoa is less important, but still something to remember that's going on. So we got that happening in the rumen. Systemically, things that we might look at are blood and urine. Ruminologically, we've got a rapid proliferation of Streptococcus bovis and Lactobacillus species. As you might guess, later in the acid peak, the Lactobacillus are what's going to increase because they're, as the name would imply, they're lactic acid producers. We get destruction of gram-negative bacteria to the benefit of gram-positive bacteria. We increase endotoxins and we decrease the protozoal counts. Some of the major lactic acid producers, Strep bovis early, and then in later pHs, Lactobacillus ruminus, Lactobacillus villaninus. So as we decrease pH, we increase lactic acid production, endotoxins. osmotic pressure in the rumen, which flows down to the rest of the GI tract and is the source of our osmotic diarrhea that we see in these calves. Initially, we have an increase in VFA concentration because we're increasing substrate. We've got higher levels there to be fermentable. Later in the period where we start to see a dip in this because some of that energy, some of that substrate opportunity is going to the lactobacillus. So we pick up our lactic acid fermentation. And we get an increase in histamine concentrations. Although the changes are little when you look at them graphically, you'll remember that we don't have to change blood pH very much for it to be a big deal. So as these cattle start to develop metabolic acidosis, they start to tell us pretty fast. As we increase lactic acid concentration, we burn through bicarb stores in the body, so bicarbonate levels decrease. As we cause osmotic diarrhea and we're pulling fluid out of the central compartment into the gut, we start to get hemoconcentration. So if you look at an acute acidotic calf and you pull a blood sample, looks pretty thick and pretty dark pretty fast. Urine will decrease pH. We tend not to spend a lot of time doing ClinPath to get these diagnoses, but we're in a college town, and for students to have the opportunity to do these things on these clinical cases is an important learning experience to help understand the pathophysiology of everything that's going on in the rumen. When we chart out and look at the bacterial counts, these are quantitative colony-forming units per gram. We've got strep bovis represented here in the dark line. So at pH of 7, and as it starts to get acidic, strep bovis counts increase. They later get replaced, later meaning further into the acidosis project, they'll move and get replaced by lactobacillus. Consequently, that drives the change that we saw in relative molar concentration levels in the bacteria. So we can model this pretty easily, and one of the things that we do experimentally and we're going to be doing for students is actually driving this acidosis model where we'll take steers. The pictures I'll show you are cannulated steers with rumen cannulas. We do this with oral dosing. We adapt them to an 80-20 diet, so mostly forage. We cut them back the day before to get them hungry, dose them with a slurry of cornstarch and cornmeal, so low particle size, highly fermentable, to simulate a bunk charge. We switch them to a very low, high grain forage diet, so that's their diet when they're hungry. We'll redose at 12 hours, and our goal is to experimentally drive pH down to 4 or 5. Well, one could sit in the audience and say, now this is a beef cattle welfare deal. How do you justify doing that? And the answer to that is you justify doing that so that we have veterinarians that graduate that don't spend the next 20 years not understanding what clinical acidosis looks like in calves. This is one of those events where once you see it and you understand it, you won't ever have to try to understand it again. You'll get it. So these are really dramatic models. There's a picture of the slurry that we use to put in these calves. This is a rumen fistula. You can do the same thing through an oral tube, not quite as fast as pouring it. So everybody see cow poop. That's a pre-challenged fecal patty on a high roughage ration. Here's 24 hours later. Notice that, so that's a close-up of cow poo. First of all, it's liquid. It's bubbly. It's bubbly because there's substrate here and there's bacteria here and they're fermenting. You can sit there and watch them bubble. Don't wonder what that is. That's acidosis in these guys. It doesn't look like any other kind of diarrhea. It doesn't smell like any other kind of diarrhea. This is calves painting back down their leg. My video clip didn't come through very well, but at 24 hours, these calves will have a shifting leg lameness. They're already showing you they've got laminitis. They hurt. They're tender on all 4 feet, so they'll pick them up, and they're looking for a combination of feet to stand on that are comfortable, and they just don't get them. So these guys will stand around. They will stand in abnormal positions. This guy's got his back legs tucked back under him. That's just how he was standing. He's clearly trying to get weight off of his back feet. Another position, these calves will have elevated respiration rates, approximately triple of what they were the day before. So in a given environmental condition, if rates were running 12 per minute, they'll be up in the 30s and 40s. They're trying to blow off CO2. That's not BRD, in spite of the reason that the calf has an abnormal respiratory character. He'll show some depression, and we all know that we sometimes say, well, BRD calves can have loose stool, and they can, and sometimes they can when it's really hot and they're driving water intake, and they can have just loose stool. But sometimes they have loose stool because they have acidosis and we think they're BRD. So you can do lots of things. You can look at rumen pH, blood pH, hematocrit. You can treat, you can do a response to therapy by evacuating rumen fluid. Any of you guys that have ever dealt with grain overload in cows that got turned out in a cornfield right after harvest, and the farmer didn't do a very good job of managing where the corn pile ended up, what can appreciate that rumen evacuation is it's a lot of work. You're not going to do it through a tube, and you've got a big mission ahead of you. When you do it experimentally and you can actually evacuate the rumen, you can really be a god or a goddess. But clinically speaking, there's value in understanding when this isn't going to work. And from an animal care and welfare perspective, there's a point in time where euthanasia needs to be part of the discussion pretty early on. Secondary effects to acidosis. Laminitis, one can look at how fast onset's occurring within 24 hours. So these guys don't take a long time. Just like a horse will get tender in a case of laminitis, these guys get tender pretty fast. It'll progress and it'll self-limit after about 2 days following a point in time event, as long as you remove the source of the acid load to them. And they'll respond to anti-inflammatories. So NSAID therapies in cattle with laminitis are pretty effective. One can argue, is there any point in doing that if they're going to self-limit? But there are some good tools out there from a therapy standpoint. A few graphic representations. So in that kind of a model, the time is always going to be on the horizontal axis. So there's rumen pH from a high roughage ration, challenged on day 0, redosed. This is Nog's work, redosed at day 1, and he gave another redose at day 2, and he's got pHs down here around 4. So these guys, you have all seen clinical acidosis at pHs of being 4, but you have to go try to make it most of the time. The example of the cow charging the corn pile where she's been used to eating corn stalks and now she got a fresh field, those will get there in a hurry. But 4s don't happen real commonly. If you're looking at gram stains on the rumen fluid, you start off here. All you need to know is that's red, and those are gram-negative organisms. There's usually 10 to the 13 or 14 total bacterial cells in the rumen of well-adjusted cattle, so there's a lot of bacteria there. And the point is, if they're on roughage, they're mostly gram-negatives. 24 hours later, there's less, because we've been killing off a lot of them. That's the endotoxin that's probably part of the laminitis process we're seeing, and you're starting to see a lot more purple. By 36 hours, you're seeing at least half of them purple, and counts are starting to come back a bit. Rumen lactate production, by day, if you remember back to the pH curve, once that pH hits that something around 5, we really start to drive lactate production up. Gram-positive bacteria drop off, gram-negative bacteria increase. Rumen endotoxin levels, again, following that challenge, by 12 to 15 hours are really getting high. This is 160 micrograms per mil. From a clinical perspective, that correlates somewhere with sore-footed. Okay, so these calves they're feeling it from an endotoxin kill standpoint. We've had discussions about fulminating BRDs and how fast, does how fast we kill bacteria on calves that are sick with BRD, does that matter? I don't know. I know that how fast we kill them here, we can drive laminitis through a cell death syndrome here, I think, pretty easily. Also rumen protozoal counts just fall out of bed. When we get into these acidotic situations, the protozoa just don't tolerate it very well. As a reminder, the role of protozoa in the gut is to help engulf starch particles and essentially change their rate of fermentation. They get protected temporarily. So rumen protozoa is a good thing, and we can make them go away, or we do make them go away when we get in these acute acidotic situations. Rumen VFAs, again, time on the horizontal. Remember I said as we increase our substrate and we go into those challenges, we're going to get more. We get more until we have such a pH, we hit a threshold and we drop it back off, and we start to get production going to lactate instead of to VFAs. Blood pH, 7.4. We don't have to change it a lot to start to have clinical effects. We're in this whole range, we're running between 7.4 and 7.35. I'm not a clinician, and I can't even tell you what normal is supposed to be, but I can say these numbers correlate with clinical representation of abnormal respiratory character. So we start to have calves that we might do, at quick look, we might say they're dyspneic. I would say they're hypertonic. They're trying to blow off CO2. Blood bicarbs dropping as an attempt to metabolically handle, this is a life-preserving choice for the calf as he's trying to balance blood pH. Packed cell volume increases. Osmotic diarrhea as these guys are moving water from the central compartment into the gut. They're not simultaneously moving blood cells there, so they're going to hemoconcentrate. So how do we manage? So if we're not going to go to an all roughage grass situation here in the U.S., what are the things that we can do? When I was a graduate student in the mid-'80s here, as I mentioned, we really thought it was all about step up. And once we got that done, once we got cattle adapted, about all we could do is manage the bunk. And when we talked about bunk management, I think we were trying to keep feed fresh. We weren't really trying to manage the rumen. We were trying to maximize feed intake. That's the only parameter that we ever looked at, is if I keep a slick bunk plan, you know, a few crumbles on the bunk just before the truck comes by was and by and large still is kind of the gold standard. That's really not about managing rumen pH. That's about maximizing feed intake. Fortuitously, changes in an industry that have nothing to do with us, or did have nothing to do with us, made this a whole lot easier. As a country, when we started using a lot of our corn supply for ethanol production, cattle feeding got notably easier. We now have a high percent of cattle on feed in this country that are using various forms of corn gluten-based products that make acidosis, acute acidosis, much less likely. And the reason for that is we've pulled the starch out and we're using it to make ethanol, and we have fermentable fibers as a significant portion of our diet. 20 to 30% is really common. And so I got out of order here. So we can adapt. Step up still is important, bringing cattle up on feed with our rations. Using products that help control that microbial shift. Rumensin is an example, but ionophore class antibiotics help that step phase. Implement management strategies that help maximize the ability of cattle to self-regulate. Well, that's meaning give them everything they need to do what God intended for them to do. Give them plenty of bunk space to eat so they don't have to fight to get to the bunk and have it be the most aggressive calf gets to eat all he wants. And the less aggressive calf gets overly hungry and charges the bunk later when he can. Maintain pens. This is getting done much better than it was years ago, but I joined a practice in northeast Nebraska, and Dr. Hartwell, another one of my mentors, is here today, and as we had a lot of farmer feeders in the area. There are less of those today, probably for a lot of reasons, but we have operations that cattle would literally have to throw their front feet up on the bunk pad, launch the rest of their body up on the bunk pad, and it was like jumping a horse into the back of a half-ton or three-quarter-ton pickup sometimes. We made it so tough for cattle to get to the bunk due to our lack of ability or willingness to manage the environment that they had to get really hungry, and it's like, okay, time to make the trek. And when they get there, they're going to really become much bigger meal eaters than they are adequate access to water. So all these things are common sense things that we can do. And for students that are in the group and you go out into practice, don't assume every yard is going to do them right. They're not all 80,000 head professionally managed feed yards. As cattle feeding has moved back to some extent north and east, we have a lot more farmer feeders, and there's a huge need for basic understanding that probably is already pretty well understood at big corporate yards and larger private yards. Select rations that have differential fermentation rates. So it's not that ground shelled corn or steam flaked wheat are bad. They're not. They're really good starch sources and they have a lot of energy in them. But anything that we can do to provide differential substrates simultaneously so that bacteria can spread out that acid load over time is advantageous to you. Manage the environment to diminish the effect of external stimuli. So mud management, heat stress, ice. So the heat stress part of that, or the blizzard part's talking about timing of your ration deliveries. We want to try to minimize stacking metabolic effects of feed intake on top of the heat stress. If we feed cattle at 7:30 in the morning in the middle of August, and it's going to be 110 degrees by noon, especially if we let them get tired, if we're coming out of a cool night, we've done a very bad thing. They're going to hit their metabolic heat load. That peak load of fermentation is going to be going on right at the time the solar energy is coming at them. So this is the time when you start to talk to producers about, let's feed at 4:30 or 5 in the morning. Let's feed a different percent of our rations. It's not difficult. It's just think about what's going on in the rumen and the bacteria that are there. Manage our procedures to diminish the effect. So, implanting at 2 in the afternoon on the 10th of August may not be a good idea. It might be fine. Maybe it's going to be 55 and a cold front that day, but think through it. It causes us to manage our schedules a bit differently. Coordinate dietary management with environmental influences. Storm rations, split feeding, metabolic heat load.